Hello, my name is James Benson and I'm the president and founder of QM2 Solutions. And today I'm speaking to you from our offices in the great state of Wisconsin. And while it's a beautiful November day here in our offices in Elkhart Lake, I wish that we were together in your beautiful state of Florida. But I'm so excited to have this opportunity to speak to the NFO meeting. So let's get started.
Audiology virtual patient management. Today's talk will go into technology, methodologies, and the delivery of virtual visits to audiology patients. But before we get started, I think what we really need to acknowledge is that today's talk is really about improving the quality of care we deliver to our patients. I have a master's degree in quality systems design, and the delivery of quality has been at the forefront of my entire career. It's interesting. Quality is something that's oftentimes hard to define. One of my old books from graduate school, Zen and the Art of Motorcycle Maintenance, written by Robert Pirsig, goes into the definitions of quality, and indeed the protagonist of this book, who is actually Robert Pirsig, goes crazy, literally crazy, thinking about what is quality. In the medical industry, there's lots of definitions of quality, some that are very objective measures and some that are subjective. But I think for the purposes of today, let's just think about how you can focus the right care at the right time to the right patient and using the right channel. And that last part, using the right channel, is really at the heart of virtual patient management. In terms of disclosures, I, James Benson, I'm the majority shareholder and president founder of QM2 Solutions. And QM2 Solutions is a company that provides patient engagement software and services to medical groups, including virtual visit technology discussed in this presentation. Regardless of what practice setting you work in, you understand that patients and your ability to serve and engage them are key factors in growing your business and financial success. We have a number of significant trends that are challenging us and are significant risks to our field in audiology. First, let's start with COVID driving visits down. I'm going to talk about that in more detail later, but most practices saw significant decreases in April, and as we work with practices around the country, we continue to see visits down year over year. Interestingly, COVID just doesn't affect our volumes. It's really been a fundamental factor driving the demand for new, convenient, and different delivery channels. If you're like me, for the first time ever, you purchased groceries online and liked it. I enjoy my increased access and use of home delivery services, and it has colored my perception of care, of service going forward, and it's doing the same thing for your practice. I think also, if you're in the business of medicine and you're serving patients in your office, you realize the importance of maximizing revenue and provider time, specifically in audiology, where much of your services have been bundled and in-office visits have often been delivered at no cost. You're recognizing the cost of overhead more than ever now, and you should be asking yourself, how can I maximize the time that patients spend in my office from a financial aspect? And finally, patients' perception of care and the quality of the care you deliver is a significant driver in their future decisions, whether or not they're going to follow your recommendations, purchase new services, and who they are going to select for care in the future. And I think as we go forward today, that these sort of electronic engagements will help drive an increased perception of quality. Diving a little deeper into the market implications of COVID and the rise of virtual visits, we'll think about what happened in April and May of this year, where we saw clinical visits at about 25% of what they were year over year at the height of the COVID crisis. Some would argue we're still there today, but before we reopened this spring, we saw a massive movement towards virtual visits. Most practices implemented telemedicine for the first time, which accounted for approximately 15% of the traditional visit volume in any given practice. This number of visits was significant. However, you can see that we didn't get anywhere near all the way back. And as we progress through COVID into today and our serving of patients, you can see that many clinic visits have returned, but we're not near or at historic levels. And you'll notice that virtual visits are still part of the solution or the delivery to patients, and this definitely varies by physician or clinician type or industry. However, most clinicians would tell you that their initial foray into telemedicine, video and voice engagements with patients was difficult, and most clinicians have just sought to go back to the way it was, and if they could stop during virtual visits, many would. Unfortunately, as we go forward, for reasons that we stated earlier and some more that I'll talk to after this slide, is that we're not predicting patients going back to normal for some time. Not only for COVID reasons, but for a whole variety of market forces are going to de-emphasize patients' desire to come into your office. So we suggest that if you want to get back to where you were, or if you have desires to grow your practice, that virtual visits is a strategy that is something that you have to embrace. I don't know about you, but I'm craving going into a fine restaurant with lots of people. I am wishing I could be a client at a resort. I don't know if the same can be said for our patients. Many of our patients need us and want our services, but there are a lot of reasons why patients are wishing and hoping not to have appointments. Research will tell us that in order for a patient to call and show up for an appointment, they're overcoming emotional barriers, inadequate fears of anxieties over their conditions. The way we historically treat patients, the cattle calls within our offices, the impersonal nature, and lack of time that they feel that they're receiving in our offices cause a respect gap that drive patients away. And the complexity of actually scheduling an appointment, going through phone trees, and identifying times and wait times and between getting into appointments creates an environment where patients are simply not calling for appointments the way we would wish that they would. So going forward as a solution, we need to find ways of proactively engaging patients to eliminate any barriers to addressing their needs. We're going to focus today on a solution to confront these barriers to practice growth and taking care of patients using virtual patient management strategies, which really are about how we can leverage different types of technologies to focus on improving care while decreasing the cost to your organization and driving new revenue sources. Where should a clinician start their virtual patient management strategy? Let's start focusing on patient needs. First set of patients we'll talk about are our ALs, these acute patients who have an identified active issue who need your help the most. These patients have something immediately wrong, and so how can you engage strategies to better triage patients so that you can streamline their access to the practice? This requires a strategy that gives you tools that and expertise to prioritize the most critically acute patients so that you're getting them at the front of the queue, and that you are able to match and have available the right resource to take care of their problem when they are in front of you. Time, equipment, people to meet their needs. Remember that these more acute or critically patients with critical issues have a high expectation for care, as they have anxieties and concerns that are driving their need to contact you. But let's also not forget about our chronically ill patients. These are patients who might not have an issue today, but these are patients with chronic conditions that would benefit from a proactive management strategy. Okay, so as a business, this gives you a prime opportunity to expand retention of these patients through the monitoring of their outcomes and a scheduled type of engagement where you're meeting their needs on an ongoing basis. And then let's talk about a new type of patient. These are patients who have an active condition. They're likely unestablished patients with you today, but they're out there on the web seeking solutions. They're asking their neighbors and friends about their conditions, and they're doing research. We believe that virtual options are a great opportunity for you to engage these patients, grow market share beyond your geography while increasing patient access. Let's dive into the specifics of a hearing loss strategy. First, let's talk about who are these more urgent acute patients. We've defined them as your existing hearing aid patients who have an issue of performance with the hearing aid itself, or having service issues that are causing immediate concerns with their hearing aid. Again, how can you create a pathway for patients to engage you on reasons that are of frustration and malfunction with their hearing aids? We've defined the chronically ill patients as those folks out there who are your traditional tested, not solds. These are patients who have been diagnosed with sensorineural hearing loss or some other comorbid condition that would benefit from a strategy of ongoing care. Okay, so the goal of a hearing aid strategy or a hearing loss VPN is to, again, proactively manage sensorineural hearing loss as a chronic condition, with the goal of retaining those patients through a whole set of options to treat their condition. And also, by the way, acknowledging other comorbid conditions like heart disease, diabetes, risks of dementia. And so putting forward strategies to keep patients engaged through their entire life cycle of their hearing loss. And then lastly, again, how can you put a virtual foot forward or storefront to allow new patients, prospective patients who have an acknowledged issue or maybe have been fit or diagnosed with hearing loss somewhere else and who are having issues or concerns, how can they take a first step with your practice to address their hearing issues? Whenever I deliver this talk to physicians, clinicians, administrators, it's common for them to ask a really good question, and that is, how do I get paid for each of these visit types? And while these are, again, really important questions, we're going to spend the majority of our talk today not getting into the weeds of and billing mechanisms, although we'll address that briefly, is really to talk about the clinical and operational and some of the financial benefits of each of the visits without getting into the actual billing and coding rules of each of the visit types. So when we talk about virtual visits, really what are we talking about? I think this is important for us to develop a common vocabulary around virtual visits. And when you look at this hierarchy, you can see to the bottom left, let's start talking about telemedicine. Telemedicine is a specific billable item where the clinician or physician uses real-time video and audio to both new and established patients to deliver care. This is what I think most people think about when they think about virtual visits, but is only really one delivery mechanism. There are others. For example, e-visits, which were created in 2019, which are asynchronous visits where a patient connects to their provider through an online portal to communicate their needs and allowing the provider to respond over a 7-day period. There are also telephone visits. We think about telephone visits as an oldest technology, and we'll get into all of these, but telephone visits are a very accessible technology and can be billed for new and established patients. And then there are another type of visit called virtual check-ins, which are very much the cousin of e-visits, again, but allowing a provider using asynchronous technology, images and telephones to connect to patients about their ongoing conditions. So when we talk about virtual visits, we're not talking about one thing. We're talking about a menu of services to increase the access of care. Let's dive deeper into telemedicine. In the early stages of the COVID crisis, Medicare and the payers migrated quickly to telemedicine technologies as they closely mimic the visits inside of a clinic. You're literally face-to-face, voice-to-voice with a patient and are able to provide a high level of interaction. Indeed, the popularity of these visits are driven by the fact that they are the same E&M codes of traditional in-office clinical visits. The popularity of these really driven over sort of a billing mechanism, and indeed they most closely mimic an in-office experience and provide a high level of interaction with your patient. However, what started out as its biggest benefit is oftentimes its most difficult or negative thing as well, because you need at least the same number of staff typically to organize these visits. Because they are synchronous, happening in real time, you need to match the physician, clinician, and staff schedules with the patients. They need to be scheduled in advance, and you need to work out issues related to matching technologies, browsers, computers, to make sure that when the visits are happening, that there are no technical issues around that patient interaction. So what started out as the most closely related or sort of mimicking visit to in-office clinicians, many found that they're actually more difficult to deliver on than the in-office experience, and why so many clinicians and physicians have pulled off of telemedicine visits. However, it should be acknowledged that this is a very powerful tool that drives increased interaction and is oftentimes something that patients would choose. Okay, I've had my personal experiences with these visits and actually have benefited and enjoyed the fact that I could literally from my office desk initiate or begin these visits without any of the travel or wait time that I would have established had I gone into the practice. And I think that this is a real opportunity for you to be able to increase patient convenience, and with some forethought, we'll be able to save some clinician time as well. So other types of virtual visits include e-visits and virtual check-ins. And so essentially what an e-visit is when a patient connects to their provider, so they're patient initiated through a web portal, to complete a visit or interview that highlight their current symptoms and functions, to provide any medical history and other questions they may have or concerns they have over their ongoing medical conditions. These are typically for established patients to connect to their provider. Okay, one of the what we have found is that this visit type, which was actually established in 2019 as a mechanism, is proving to be a really powerful tool for both patients and clinicians, in that these interactions allow the practice to triage any issues they have in order to follow up with the patient. Because they're asynchronous, they allow the provider to triage and to understand and to prioritize both the level of response and the time to respond to those patients based on a variety of internal factors. They also allow you to open your door to an incredibly large number of patients without using very much upfront staff time or clinician time to engage these patients. It is also solves another huge problem for practices, in that there is a very low threshold for the patient to contact the practice. They just need access to a secure web-based portal to be able to initiate and actually complete their visit. So they're doing it via their smartphone, their computer, or tablet, which eliminates the travel time, the appointment time, the need to even to create an appointment to engage their providers. So again, unfortunately, these visits are non-billable for audiologists. However, physicians and other non-physician providers are able to bill for these visits based on the time they submit or that they spend evaluating and making medical decisions. So again, a real powerful tool to engage patients and to expand access to your practice. Can be an important component of a virtual visit strategy. Bottom line is they are easy for the clinic and for the patient. It is a low-cost technology that both the patient and the clinician typically have in their pocket, literally. It works well. You're not having to worry about browsers and internet technology that you would with the other capabilities, right? The negative side of this is obviously with hearing loss patients is the overall communication difficulties that might come with the operation of a telephone. For billable providers, it's a lower RVU than other visits, that you don't have the visual and requires real-time interaction, meaning that someone has to pick up the call in order to make that visit happen, or a scheduled visit must occur. But I think there is a real place for telephone visits, and people should not be afraid of the lower RVU or the less level of interaction if it is the right interaction for that technology. And again, that's what we're going to talk a little bit more about is making sure that not all interactions require face-to-face clinical visits. There are some that are more efficiently held, that we can hire higher volumes of interactions if we use the right technology for that type of interaction. Let's highlight virtual visits with each patient type. I'm going to start with our acute, more urgent patients. For you audiologists, this may be your existing hearing aid patients. So first of all, by creating an e-visit strategy where we are engaging patients or providing a way for patients to directly access you through a web portal, we eliminate the emotional patient barriers to making appointments. They're not worried or concerned about the safety or whether or not they should even be calling for an appointment now. We have found by opening up a pathway to e-visits, patients are much more willing to come in, and we eliminate both cost barriers for the patient in terms of transportation costs, visit costs in a billable clinician situation go down, but also practice costs go down as you need less staff to manage the increased volume of calls and less space to take care of those patients. It also has proven to be improving the perception of care and quality that the patients have. By being able to feel like patients can access you at any time, 24 hours a day, means that patients feel they're receiving better care. Interestingly, as we've promoted e-visits with patients, what we have found is, number one, we will actually increase the number of in-office visits. And patients love it because it speeds access to those who need you most. A good e-visit system allows you to prioritize and triage those patients who are coming in so that when they come in, you are ready for them. You have increased the efficiency because you have gathered patient information before they've come in, and you're able to gather and make sure that resources are available for that visit so that the most activity can be completed when they're there. And it's this thoroughness which provides the patients with the perception of the best possible patient experience. But maybe that initial e-visit doesn't turn into an office visit. Maybe it turns into a phone visit, but that's okay because this again increases convenience to the patients. They perceive an increased thoroughness of care, and ultimately will decrease their time horizon to resolution often, right? So because they're not having to schedule an appointment and fit into a more rigid schedule, these phone visits can be fit in at times that are most efficient for both the patient and the clinician. And so sometimes these visits can move on to an office visit, which progress the care there from the telephone visit, but then oftentimes they turn into a telemedicine visit, which again may lead to a more efficient in-office visit. You often have been able to order additional testing and care with other specialists who may need to be involved with the care. So when that patient does come into the office, you have the most information there. Diagnostics are often completed through orders of the telemedicine visits. And so we're dramatically decreasing the time horizon to patient resolution. But what we're finding is that as practices delve more into these technologies, the more they're learning that they can take care of the patient in a strategy that may be 100% virtual, which allows increased patient connection and expands the flexibility for both the patient and the provider to deliver care, and ultimately will lower overhead costs for the practice while decreasing the patient's expense. Win-wins. So let's think about the care of that chronic patient, those Charlies who have sensorineural hearing loss that you wish that you would have the opportunity to take care of, right? And so we recommend, or what we have done with our groups, is set up an automated communication platform to engage patients at routine times to expand our ongoing engagement with those patients. Okay, again, by providing them an e-visit option that when they are ready to pursue care, we have again reduced some of the barriers and difficulties of scheduling appointments and allow those patients to know that we're not only taking care or trying to sell them some sort of device, but we're in thinking about and engaging them about their ongoing chronic condition so that when they are ready, that we want to be the ones who take care of them. And what we have significantly found is that when we do that with patients, that they are much more likely to act on the condition before they become more significant, right? By a great example of doing this in the hearing loss industry is, again, asking patients about issues of memory loss, or if they've had changes in conditions with their heart disease or diabetes, and outlining how these conditions may lead to and personalizing our interactions with patients about these conditions has led to patients desiring to take care of their hearing loss before these other conditions may more dramatically impact them, and has driven more office visits regarding their hearing loss. Okay. Again, but sometimes these visits, maybe the patient's not ready for in-office visit at that time, maybe a follow-up with that patient routinely on the phone, again, increases the number of touches to that patient and increases the likelihood that we are going to retain that patient when at the time they are ready to purchase or move forward with some sort of hearing intervention. And the combination of these things, again, decreases the time horizon for those patients to decide to pursue care. Okay, and oftentimes these patients, instead of having them worry about the drive time, the wait time in your office, they're very happy to engage you via telemedicine. A recent Barrel Group study showed that nearly 40% of patients would actually prefer virtual visits and telemedicine over in-office visits, and that 26% of patients have no preference. What this means is 2/3 of these chronically ill patients would either prefer a virtual visit or have no preference. So let's eliminate barriers through in-office visits and take care of these patients and move them along the care chain, because actually ultimately by able to provide a ongoing 100% virtual patient management system, you're going to give yourself the ability to alert yourself to any changes or a decline in patients' functions that you can take care of. You're going to be improving the coordination of care across specialties. Audiologists for years have been desiring a greater stake in that patient's overall health and engaging with primary care providers and other specialists in taking care of patients. What better way of doing so than to routinely engage patients remotely through virtual strategies about that patient's ongoing health, which ultimately are great practice builders. And through these methodologies of ongoing visits, education, you're giving patients all the information and understanding so that when they're ready to make decisions, they make good ones. Let's talk about the virtual visit strategy with our Janets, these new patients who are just in time seeking answers to questions that they have. I think it's important to know that, especially in the hearing industry, where younger patients are oftentimes reticent to seek out hearing health care, by lowering and having a non-human face-to-face way for them to interact with an expert on their hearing loss will or does increase the likelihood that they're willing to engage with their provider. And once they do engage with that provider, they're much more likely to engage with you in the office. From a provider standpoint, this is a very valuable opportunity for you to identify the right type of patient for your practice. Let's acknowledge the fact that oftentimes office visits are filled with patients that you cannot help. They have not been adequately worked up. They're either seeing you too early in their care journey, in their patient journey, or they have a condition that you are unable to treat, leading to decreased patient satisfaction and a loss of efficiency for you and lost opportunity for your practice financially as you fill your office visits with less valuable patient engagements, right? So if you're able to engage those patients before they ever come in, you're going to increase the effectiveness of those visits when they come on site for your visit. And maybe you need to deploy, again, phone visits before that patient come in to confirm that they are the right patient, gathering more information. But recognize that multiple access points is a key determinant of patient choice. Patients want to connect you via virtual options, in-office options, and other ways so that the more access, the better their perception of the quality of care you deliver. And remember, going from the top, where we're now able to expand the geographical marketplace of your visits. Telemedicine visits will, again, in remote programming, allow you to take care of patients from a greater geographical distance. What we've also found is that patients will travel for care that they perceive as higher value or more quality. So by taking care of the patients first through e-visits, phone visits, and telemedicine, we know that patients will travel greater distances for those in-office necessary visits, okay? Because those visits will be of increased value. We've covered a lot. The market conditions that are driving virtual visit strategy. We've talked about the different tools and how you need to consider the individual needs of your patients. We've talked about some basic strategies, but you're probably thinking, where do I start? I would suggest that you start by connecting to many, many patients. Our philosophy is make patients aware that you have a virtual visit technology using texts and emails to both notify patients of virtual visit options, but importantly, connecting patients to encrypted, secure web portals where patients can initiate different types of virtual visits with your practice. These messages should serve two purposes, really. One is to educate your patient about your efforts to try to serve them better, and also provide them a tunnel or connection to virtual visit options. One of our key suggestions to our practices is the nature of these communications and virtual visit strategies is to cast a wide net. The goal here is to open your door and reach out to as many patients as possible to let them know that you're available and open for service. With this slide, we want to highlight your efforts around a virtual visit strategy is to focus on making it as easy as possible for patients to connect to you. Our solution includes a single click entrance into the S-Engage platform, but if you already have a portal system within your practice and ways to connect patients to other virtual technologies, the goal here is to make it as easy as possible. If you're going to do billable visits, that it's important that the patients both drive those visits and consent to being billed for those occasions. All right, that's an important component. However, for audiologists, I think the key point here is to also draw a distinction that we are not marketing to patients. These are not marketing message, buy now, special offers. You're opening up your door and letting patients know that they have a tool to engage their clinician or physician. Okay. You can do that to a broad audience, and what you will find is that you literally have hundreds, if not thousands, of patients who are sitting on the sideline with clinical needs or concerns that you can address. Opening up that pathway, you'll be surprised how many patients will walk through that door. Okay. Also remember that this is a great opportunity to develop specific programs around different chronic conditions like hearing loss or like dizziness. And with a little thought beforehand, you can develop and deliver targeted communications and clinical experiences through these virtual visits that drive significant engagement and satisfaction with your patients. I think one of the most beneficial elements of this strategy is that when patients respond to you through an asynchronous tool, it gives your practice the time and ability to sort and respond to patients in the most rational way. If you think about your office today, patients call and you answer those calls as they come in, and you're really forced to address each patient concern or condition before you know what's coming in next. which doesn't allow you to plan resources accordingly. This strategy allows you to collect multiple responses and being able to respond to these in a rational way that allows you to best use your own resources. And in our system, as well as other portals, the great thing is that the patient's responses to you are in real time, which allows you to act fast to patients who need you, but also gives you time to interact with those responses and prioritize them so that you're not wasting time on efforts that don't yield either better patient care or more revenue for your practice. Finally, you're going to want to take those responses, forward them on to the appropriate provider, and allow them to document accordingly what those next steps are. Organizations that we work with, this is a very important step to operationalize an effective response mechanism to make sure that patients that need to be scheduled are, and those that have to be scheduled with additional virtual visit options or have other actions taken, that you have the right person in place to make those decisions. Time and time again, when we have done these programs with different people, we find that the follow-up for these often are additional telemedicine visits, many times leading to on-site or clinical occasions or phone calls. In the case of audiology, we've driven curbside pickup programs or home service or delivery programs to drive care instead of having patients come in. It's been surprising how we've been able to address patient concerns, or help our clients address patient concerns with remote programming or other devices that can improve the performance of their hearing aids or other devices, or we schedule additional e-visits or follow-ups to make sure that we're keeping in contact with those patients who need us most. Let's talk about real-life examples and real-life results. So on April 6th of this year, Hearing Aid Associates of Florida contacted QM2 Solutions to develop a virtual patient management program for 6 of their audiology locations. In conversation with their audiology director, Dr. Patricia Ramos, we created 2 patient programs, one for hearing aid patients and a second for those diagnosed in their practice with sensory neurohearing loss. In order to set up the program with us, we needed to work with them to identify those patients, the time frame of which we wanted to reach out to those patients, who their practitioners were, and get some basic demographics that we could help facilitate the connection to those patients. So within a couple of weeks, we were able to set up the program in our portal system and organize, test, and discuss a launch of this program. We implemented a few tests with their staff and a small cohort of patients to fine-tune the types of questions that we wanted to engage patients about, and what kind of response would we receive from patients so we could better communicate our intentions of better serving those patients and to determine how much need patients had for the service. After testing the program, we launched the first hearing aid interaction with hearing aid patients, which was focused on their existing experience with their hearing aid and the performance of their hearing program. We started in late July engaging 1,000 hearing aid patients at 6 offices. So over 55% of the patients actually opened and read the communications introducing them to the program. Keep in mind, at the time we started this program, none of the hearing aid patients were aware that they were going to be contacted or offered these options. So the fact that 55% of the patients opened and initiated was very encouraging. We found that 32% of the patients then completed online engagement about with the practice, and 30 of those patients actually initiated contact with the group about new products. Keep in mind, the practice did not ask if the patients wanted to purchase new services. It was not a marketing effort, and within that month, 20 patients moved forward and completed purchases of hearing aids of a total of about $94,000. So this was our first effort, and we were encouraged to start our second program regarding sensory neural hearing loss. Our next effort with ENT Hearing Associates of Florida was to focus in on those patients who had tested with sensory neural hearing loss but had not purchased hearing aids. We looked at 7,000 patients in the original 6 offices that we served. And keep in mind that our interaction here, again, was not focused on marketing, but was to open up a dialogue about their hearing loss as a chronic condition, and also engage them about perceived changes in their hearing, as well as other health conditions that might be impacting their hearing loss. So we started with the 7,000 patients. 3,900 of those patients opened and read the messages. From that group of patients, 517 patients fully completed hearing loss follow-ups in that first 2.5-week period of time. Okay, 147 of those patients requested audiologist follow-up, meaning that these are patients who had, for whatever reason, denied care through their initial visit, or maybe were never even asked, by the way, which is also a real issue, particularly in ENT offices, of patients who have been tested for maybe other reasons, who have moderate to severe hearing loss and actually never end up seeing the audiologist. So here we had 147 patients requesting follow-up. And the challenge here for the practice was not having enough patients to follow up, but was allocating staff and making sure that they were taking the time to follow up with those patients, engage them. The success of this has been pretty significant, with a close rate, meaning that of these patients who had sensory neural hearing loss, had gone through requested follow-up, 35% of those patients were ending up purchasing additional services and hearing aids from the group. Within that very short period of time, we had generated enough interest to generate approximately $250,000 worth of hearing aids, which at a time of COVID and market conditions signals that not only is this a strategy where patients feel like they're being taken care of and offering up new channels, it's actually a strategy that will generate more business for the group. Real life examples, real life results. Willamette ENT is a 5-physician group up in Salem, Oregon, and they reached out to us in June of this last year with an issue that they had reopened. The practice was seeing patients in office, but they were having a difficult time reconnecting with surgical candidates. So at that time, they provided us a list of patients who had requested and were candidates for surgery. We worked with them to create custom messaging to outline a virtual visit strategy where we could engage patients who were surgical candidates on behalf of the practice, and reached out to that list on a Friday afternoon. So when staff returned to the practice on Monday, they found that 22 patients were requesting specific surgical times to be completed within the next 30 days. And while this practice had a full-time surgical scheduler working in their office, they had not been successful at scheduling any of these prior to a virtual visit strategy. Keep in mind that each patient has different preferences and ways to communicate, and traditional phone and wait methodologies were just not being successful. So within a very short period of time, we were able to turn a virtual program into more than $125,000 of revenue for this practice, and service delivery and relief to 22 patients. Real life examples, real life results. What I think I'm most proud of with what we have done is how we've been able to help practices like ENT Hearing Associates of Florida, or Willamette ENT up in Salem, Oregon, or Alabama ENT Associates up in Birmingham, Alabama, or Colorado ENT and Allergy out in Denver, Colorado, and the list goes on, are the fact that we're able to not only improve the lives of their patients, but that these new strategies generate revenue, which are the lifeblood of these medical groups. The results of these programs are real. Virtual patient management strategies will increase not only virtual visits, but in-office visits of the right patients. This has demonstrated time and time again to drive increased revenue into the practice. And what's exciting about this is that the technology that you're going to be implementing is not hard to understand to make this work. And the cost of implementing these new digital strategies are significantly less than other traditional methods, and will actually lower your cost per visit to implement. And at the end of the day, it's really about serving the right patient at the right time with the right intervention. And I think what we've demonstrated how the right channel can increase that access to patients.
Thank you for your kind attention today. I very much appreciated the opportunity to talk about our experience doing virtual visits with audiology practices. If you have any questions, please don't hesitate to reach out directly to me, James Benson, at jbenson@qm2solutions.com. Our phone number is 888-580-5282, or feel free to stop by the booth while you're our virtual booth here at the convention. Again, from our beautiful state here in Wisconsin on a lovely fall day, thank you and have a great rest of your meeting.